Janet Johnson is a 69-year-old woman with a history of COPD and renal insufficiency. She was hospitalized with pneumonia for over a month. While she was hospitalized, she received IV clindamycin and steroids. She was discharged a week ago with an oral prescription of antibiotics and steroids. This morning, she presents to the emergency department with watery diarrhea that has a strong odor and has been occurring for the past 2 days. Janet stated she has been having 10 plus episodes of diarrhea per day. She has been complaining of abdominal cramping and tenderness, coupled with nausea and vomiting. Her daughter has accompanied her to the emergency department because Janet had become extremely weak and drowsy with bouts of confusion. Her vital signs are blood pressure 100/68, pulse 110, respirations 24, and a temp of 38.1. Her daughter stated Janet has not been able to keep any food or drinks down, and she was concerned for her mother's general health. Priority treatment goals for Clostridium difficile infection is to restore the normal balance of bacteria in the colon and to take the necessary steps to prevent the spread of the infection to others. This can be done by discontinuing the current antibiotic therapy and starting on a different antibiotic to treat the infection, and proper precautions when in hospital, as well as enforcing hand washing with soap and water. If C. difficile is left untreated, complications that can arise are dehydration, toxic megacolon, sepsis, and ultimately death. The recommended drug therapy for C. diff is fidaxomicin or vancomycin. Fidaxomicin is most preferred over vancomycin to treat C. diff as it has a lower risk of recurrence, and vancomycin can cause acute kidney failure, especially in elderly patients. One downside of fidaxomicin is it is more expensive than vancomycin. Fidaxomicin is an anti-infective macrolide, and its mechanism of action is treatment of diarrhea associated with C. diff. It provided bactericidal action mostly against Clostridia, which inhibits RNA synthesis and acts locally in the GI tract to eliminate Clostridioides difficile. Two side effects that should be monitored when taking this medication are GI hemorrhage and hypersensitivity reactions, including angioedema, which is swelling beneath the skin or tissue. If patient is allergic to fidaxomicin, they can take vancomycin. An alternative medication to fidaxomicin and vancomycin, if patient is sensitive to both medications, is metronidazole or Flagyl, which is recommended for mild to moderate cases of C. diff. Probiotics can also be taken with this as well to help restore the healthy bacteria in your body, as well as preventing the incidence of recurrence. Patient education that would be provided in relation to the course of treatment would be to take new antibiotic medications for as long as prescribed. If patient is in hospital, they will be placed on contact precautions in a private room to prevent the spread to other staff, family members, visitors, and other patients. Any surfaces that can become contaminated with stool may spread the disease. Hand hygiene is very important, as this can reduce the spread of the bacteria. Patient must wash hands with soap and water, as the spores from the bacteria cannot be removed with an alcohol-based rub, and they should be washing their hands right after using the bathroom and prior to eating. If patient is at home, a separate bathroom should be used if possible. Any high-touch surface areas should be cleaned and disinfected frequently with diluted bleach solution, as the spores can be resistant to most chemicals used in cleaning. Any bedding or clothing that becomes soiled must be cleaned in washing machine with hot water, detergent, and bleach to prevent the spread. To prevent dehydration, patients should drink plenty of clear fluids. Patients should try to eat starchy and fibrous foods to help reduce watery diarrhea. Treatment for C. diff is considered successful if the patient has had no diarrhea for 2 days in a row after finishing the antibiotics. After treatment, a repeat CDI testing is not recommended if the patient's symptoms have resolved, as patients often remain colonized.